And I want to welcome Dr. Petty this morning. So students, you're in for a treat. So thanks,
All
Dr.
right,
Petty, for being
guys.
here.
You're welcome. You're welcome. Thanks for having me. So my name is Eric Petty. I have a doctorate in physical therapy. I want to try to keep this informal and tell you all the things that you can't find on Google. But just a little quick background. So I'm from Philly, from the Mount Airy area, Wadsworth area. Went to Temple University to get my doctorate. But prior to that, I went to Hampton University to get a business management degree. So if you don't know anything about physical therapy, you generally are going to get an undergrad degree in something else. And then you're going to head to PT school and get your doctorate in physical therapy these days. I've been practicing since 2004. So, 17 years or so. Pretty much covered every setting in physical therapy, which is probably one of the biggest pros of physical therapy is there's a lot of different settings. So I'll try to get into that a little bit, but basically, physical therapy is just, we are experts in functional mobility, just at its very core. So functional mobility, meaning anything that someone needs to do to function, we are the experts in that. So whether it's walking, whether it's getting up and down from a chair, or whether it's an athlete and how they throw a ball, whether it's a child who has like disabilities and how they're going to get around in their wheelchair, whatever kind of requires function, we generally are the experts in that. So you can go a lot of different places when it comes to physical therapy. So I started in the hospital. I've worked in, I originally, and I don't know if any of you are like this, because I know she mentioned sports medicine. Sports medicine tends to be the sexiest physical therapy, I guess, specialty. And that's exactly what I wanted to do coming out of high school. I was going to be sports medicine guy. That kind of ended for me in my last clinical rotation in physical therapy school, where I was able to work with Division I athletes at Oklahoma State University. And me being a former football player, I thought I would like it, but it was something about being on the other side of things that it didn't mesh well with me. So I found out that I really didn't like working with athletes. And, these were D1 athletes. Some of them went to the NBA and NFL the very next year. And I found out that just wasn't my thing. I kind of cringed with touching sweaty feet and stuff like that. So if you are someone interested in sports medicine, I encourage you, even as early as high school, volunteer in the athletic training rooms in your, high school football team, basketball team, volunteer with athletes, different places. If it's not sports medicine, if you think you want to work with older people, volunteer at the nursing home. If you think you want to be in the hospital, volunteer at the hospital. Volunteer as much as you can, get in those settings and make sure that you're feeling it when you get in there. You'll kind of know. And I knew pretty quickly, I was a little bit prideful, so I held on to it for a little while longer, but ultimately I moved away from the sports medicine. So I started off, I went into the hospitals. I then worked with nursing homes. I then owned an outpatient, I worked in outpatient physical therapy. Then I started my own outpatient physical therapy clinic with some partners, and kind of did the business side of that. I've done home health. I've pretty much worked in every setting in the physical therapy world, with the exception of pediatrics, which I had a small dose of during clinical rotations. The take home message from that is that, in this one profession with that one degree, you can probably do like 50 different things. So, if you're not sure right now, don't worry about it. You can kind of pick it as you go. If you do think you're sure, just know that really with just a few certifications or a little bit of a review, you can kind of go into any different specialty in physical therapy. That degree will take you from a hospital to home health physical therapy, to nursing homes, to pediatrics with kids, to sports medicine, pretty much all over the place. That's pretty much my story. Hopefully y'all know the basics. Physical therapy is a doctorate level degree at this point. The American Physical Therapy Association had a goal for 2020 that all physical therapists would be doctorate level. I don't know if we've quite achieved that. I think some of the older therapists will just kind of fade into retirement without getting that doctorate degree and kind of stick with their master's. I don't think you're going to find too many with less than a master's in the field anymore, but generally speaking, it's a doctorate level degree. As you guys get into the world, I mean, we're supposed to be autonomous now, but as you guys get out there, you really be in an autonomous setting. And what I mean by that is historically, physical therapists were basically dependent on physicians and even dentists or chiropractors or whoever to refer them patients. And we had to kind of see patients and then check back in with the physician or check back in with whoever referred them. With direct access, which is a way that we can basically see patients without any referral, meaning that, you know, Mary Jo on the street can just walk into your office and say, I need physical therapy, and you can work with her without calling her doctor, without calling anybody to get a referral. That's a really big deal, and that's part of the reason why we're doctorate level, but it hasn't really manifested itself like with the masses yet. Medicare and a lot of insurance companies still require that you have a physician's referral, which basically means you need the physician's okay to do what you're going to do. And there's different little guidelines. Sometimes you can see a patient for 5 visits before you get a physician referral, you know, sometimes longer, but at the end of the day, you have to get a physician to kind of okay what you're doing or kind of coordinate with what you're doing. But by the time you guys get out, it's very likely that you can just have a patient come in off the street, provide them physical therapy, you know, for whatever amount of time is necessary. And, you know, when they're better, you just say bye, and you never have to get involved with another clinician. And, you know, when you get into healthcare, you'll realize that all the parts kind of work together. So you might want to still have that support from your other healthcare professionals. But it's a beautiful thing when you don't have to depend on someone to refer you patients, when your livelihood is not connected to your relationship with another professional. So that's a really positive thing if you're looking into this field. In terms of like, I know in high school, at least for me, I was concerned about money. You know, physical therapy is I would say it's a upper middle class type profession. You know, you can definitely push 6 figures with some hustle, and you can push way past 6 figures with, you know, if you really want to hustle. You know, you just want to kind of go to work from 9 to 5 and come home. You know, you're gonna be right on the heels of 6 figures. If you really want to push it to the limit, you can go well past that. The beauty is you can do just about anything. You know, 2 of the guys that I graduated with are head rehab guys in the NBA, one with the Wizards, one with the Hornets, you know, where I am in North Carolina. And one of them even works with the Olympics. I think he's doing some stuff with the Olympics right now. I got a guy who works with NFL players. I know guys who own multiple clinics, girls too. So it's a really wide range of outcomes, from the person who just goes 9 to 5 and gets a salary, from someone like me who gets paid per visit and does a whole bunch of extra things related to physical therapy to generate income, to the person who's, you know, in the Olympics, professional sports players and stuff like that. So you can kind of make it what you want from a financial standpoint. You know, I know a lot of physical therapists who do better than physicians. You know, so I kind of weighed some of that. I didn't want to go into the full out medical field. I don't like blood. I don't like needles. I don't like some of that stuff. But, you know, at the same time, at least in high school, I was definitely interested in making a lot of money. So you have to kind of look at what your plan might be from that standpoint. I think that's kind of everything. I'd be interested to see what questions y'all might have, or which areas you might have questions in. Anyone have questions?
We're gonna open
Anybody actually interested in physical therapy? Like really interested, like, you know, looking to major in something related to physical therapy? All right, well, what I would say is if you do gain that interest, my advice for you is to really pay attention to science, like really pay attention to science. It's going to be all about science if you're going to get into PT school. So anatomy, physiology, if that's offered to you, physics, chemistry, all that stuff is going to be the main, it's going to be the main stuff that's going to get you in. I mean, obviously you have to get good grades. Physical therapy school is pretty competitive right now because y'all are in Philly, right? So like when I went to Temple was the 5th highest ranked physical therapy school in the country. I don't think it's quite that high, but it's still got to be top 20 or something like that. So it was the thing where you pretty much, I think we had to have like 3.5 or better coming out of undergrad. And you had to have all your prerequisites, all your sciences taken. So even though I got a degree in business management, I took all of my pre-med sciences. So I had already taken anatomy, biology, chemistry, physics, all that stuff. And those grades are going to really carry a lot of weight as to getting accepted to physical therapy school. So I would really, if you don't like science, I would really kind of consider whether physical therapy is the right place for you. And then, if you think that's something you want to do, like I was a personal trainer late in high school, and then all through undergrad, I was a personal trainer. So, if you don't like exercise, if you don't like working out, if that's not interesting to you, the body and how the body works and how the body functions, that's something that you really have to ask yourself, like, is this of interest to me? Because it's going to all be about science, how the body works. And then last but not least, you're going to have to really like people, because physical therapy is not a job that you can really, some places in corporate America, you could just sit in your cubby all day and not interact with anyone. Physical therapy is going to be all about interaction, whether you're interacting with your patients, whether you're interacting with your peers, referral sources, stuff like that. So you're going to have to be with people and kind of enjoy being with people. I majored in business management, but one of my deans or something in undergrad, she was the one who guided me towards business management. She recommended that I either do business management. I'm sorry, Siri's in my ear. She recommended that I would either do business management or psychology in my undergrad, because psychology will help you with a lot of the things you'll deal with in the physical therapy world. Kind of being able to get through to people, get people to do what you need them to do, or understanding their problems. And then business management is kind of a good foundation for anything, because like I said, I own my own clinic. Right now I own my own publishing company. You're gonna want to own stuff. You're gonna want to know how to move in the business world. So I would check off those first boxes with science and exercise and the human body, just to point you in the physical therapy direction. And then once you go in that direction, you still want to kind of match it with some type of foundation, business, psychology, or whatever else you might believe. There's this real common path that a lot of people will take, is that they'll major in like kinesiology or health management or something health related in undergrad before they go to PT school. And to me, that's redundant. So if you're taking health stuff in undergrad and learning anatomy and all that stuff, and it's redundant, because when you go to physical therapy school, you're going to learn it much better. So my advice would be do something else in undergrad. Build some versatility in undergrad with a business degree or a psychology degree or interior design degree, for all I care. Just take your sciences that you need and, take the things you need to get into PT school, but don't take all of the sciences, the extra sciences and stuff like that a kinesiology degree might offer, or a biology degree is going to offer, because all you'll do is just repeat that stuff in physical therapy school, and it will be redundant. It won't really add anything to your resume or to your overall, skill set. If that makes any sense. So
Dr. Petty, could you repeat again, how many more years of
I
school
think you're on mute.
after?
I think either y'all are on mute or I can't hear y'all.
Can you hear us?
Hold on.
Can you hear us? Hello? Hello? Can you hear us now? Alicia, can you hear me?
I can't hear you.
Sorry.
Yes, I can hear you.
Okay. Can you hear us?
Let me figure out what I did. I don't know what I did. Sorry. I'm going to come out real quick and just see if I can figure this out.
Hello?
Can y'all hear me?
We can hear you. Can you
Okay.
hear us? Oh.
I don't know what happened. Okay, how many more years of school do you need for after undergrad? So physical therapy school is usually going to be 3 years. I think some of the programs are actually 3 or 4 years. My program was 3 years and they consider it accelerated. I think some of them go 4 years. But within that 4 years, you are going to have clinical rotations. So it's not like undergrad. It's not like you're going to school the whole time. You're going to be doing 3 or 6 month rotations where you're just going to go off and work. So in our program, we had 3 of them. And I believe each of them, I think 2 of them were 3 months and 1 of them was a little bit longer. So you'll be in the hospital for a certain amount of time. I did Oklahoma State University, and then I did outpatient physical therapy. But it's a good, grueling 3 years.
So you guys can use
Any other questions?
Chat feature if you would like to ask any specific questions you have. Good,
Any
Tamar.
courses I would recommend in high school to get started. In high school, if you have the opportunity to do like advanced placement science, I would do that. You know, so I know in high school we did like biology, you know, you do your basic biology and stuff, but if they'll allow you to do any type of advanced placement, anatomy, physiology, those are going to be your core too, anatomy and physiology. So anything dealing with anatomy and physiology, I would take it. If you can get your chemistry and physics out of the way, I would do that as well. So, you know, if you're in your senior year and you're in advanced stuff, just keep taking as much science as you can. But anatomy and physiology are at the top of that list in terms of what's going to help you in the physical therapy world. You're welcome.
Anybody else have any other questions? You guys are doing a great job. This is
I can hear
good.
y'all. I'm sorry. I don't know what happened.
Oh, can you hear us now?
I can hear you now. Yeah.
Ah, awesome.
I guess my
You
desktop just do
you
something
must
weird.
have done something. I don't know. I had no video this morning either, so I don't know why. No, it is technology at its best.
Yeah.
I
Are you guys all seniors?
think there's a
The-
little bit of a mix. So
Okay.
what do
I'm done school.
Say that
Alicia,
again?
say it again?
I said I graduated school. I'm not in school no more.
Okay.
So Alicia's in our parenting program, correct?
Gotcha. Okay.
Yeah.
Okay.
And Tamar's an upcoming junior.
Okay.
Anybody?
So now one thing I did not mention, and I don't know if anybody's interested in this. So I said physical therapy is very versatile and you can go a lot of different directions. And just to be honest, like everybody doesn't want to spend 7 years in school. 4 years of undergrad, 3 years of PT school. So the other option or other options are you have physical therapy assistants. And trust me that this field is headed towards physical therapy assistants running it. So a lot of people know about physician's assistants, but just like a physician, I have multiple assistants that kind of follow my plan of care. Some of them probably do more visits than I actually do, and I have to sign off on that stuff. And I believe the physical therapy assistant programs are 2 years. And it's technically an associate's degree, but you have to take, like I said before, you still have to take your anatomy, your physiology, and your different sciences. So for anyone who might say, you know what, I can't do 7 years, or it's later in life, or whatever's going on, you can only go at night, I would definitely look into the physical therapy assistant programs. And similar to the physical therapy path, it's all about hustle. There's physical therapy assistants that actually own their own practice. Now that requires that they contract with or hire a physical therapist to oversee their clinical work, but at the same time, they can still own the building. They can still own the business. There's physical therapy assistants that are, working in multiple places and pulling down just as much as physical therapists with that hustle. So you can go the physical therapy assistant route, and then the very final route is there are physical therapy aides. They generally are going to be more in your outpatient settings and your hospital settings. But even physical therapy aides are making a decent living, and that doesn't require schooling at all. That's just a matter of going in, being trained. So, you have 3 different layers of professions in that field if you don't want to go all the way through all of that schooling.
Dr. Petty, is there one area that you would say would be, not hot, but something that would be an up and coming area in physical therapy that maybe, students can gravitate towards? I know that senior population, our boomers are getting older. So, healthcare and senior care, is exploding. Or will be exploding in the next, 5-10 years. Is there an area that physical therapists, are needed at this time?
Well, so you hit my sweet spot, which I'm biased to. I don't know if you see this big 65 behind me.
I do.
I'm all about seniors. So
Awesome. I did see the 65.
Yes, I founded a movement called the 65 movement, and the 65 stands for the age 65.
Love it.
So, that's the centerpiece of everything I do, because that's the moment where a lot of us, including us, will see our lives transition. And your parents, your grandparents, that's where you see them it's almost like hump day. It's where, you're either going to go right and live a glorious life that's going to be full of vacations and all this stuff, or you're going to go left and you're going to live a life that's filled with arthritis, chronic illnesses, and stuff like that. So to your point, America and really the world is getting older. The more medicines and things we have to keep people here longer, we're getting older. So if you're looking for job security, I will say working with the older population, working in geriatrics is definitely the hottest place to be. Really kind of digging into that, really making that your niche. You will never, ever, ever look for a job, because it's always going to be a skilled nursing facility, assisted living, an independent living facility that's looking for a physical therapist. In terms of like hot, there's always going to be your niche, like, or niche. I don't know how people want to say that, cash-based physical therapy things. So like dry needling is something that's come up big in the last 5 to 10 years. It's somewhat of an offshoot off of acupuncture, but it's different. And a lot of people pay cash for that. So you'll see a lot of physical therapists go get their dry needling certification. Craniosacral, which is more of a manual technique that you could kind of say is a mix between massage therapy and chiropractic. You'll see some people specialize in that. That's also usually a cash pay thing. Those are really like small specialties that will come, and I believe will come and go. They're things that people can kind of poach from us, meaning that a massage therapist can come in and do something very similar to craniosacral, and all of a sudden your patient goes there for a cheaper price. So I'm wary of those type of things, but one thing that will not change is that our population is getting older. And it's always somebody out there with arthritis. There's always somebody out there who needs cardiopulmonary rehab because their heart is getting older. So the longer we stay here, the more physical therapists are going to be needed. And there is about 3, I don't know what it is in Philly, but nationally, there's about 3.2 jobs per physical therapist. And that is rivaling, that's going to be more jobs than most professions. Mostly all of your occupational therapists, a lot of your doctors and nurses, there's 3 jobs per person because we just can't spit out enough therapists to handle all of these older people. When it takes 7 years to create a therapist, you can see why we can't keep up with baby boomers and all these generations as they get older. Hence the reason why I say PTAs are taking over, because I can create a PTA in 2 to 3 years, whereas it requires me 7 years to create a PT. So yes, there's a huge need in geriatrics in the elderly population.
Gotcha. That's great. What do people mostly come in for physical therapy for? I know you mentioned a couple, issues like, but what's I would say, some of the things, the ailments that people come in looking for physical therapy.
So in my I do home health with mostly geriatrics. So our number one thing is going to be falls.
Yes.
If you look at the CDC, cdc.gov, it kind of tells you what we're spending the most money on. Heart disease is always going to be number one.
Yeah.
But when it comes to the senior population, it's going to be falls. Falls is the number one cause for fatal and non-fatal injuries. So a lot of our patients are going to be suffering from, I had a fall and whatever injury came about afterwards. So hip fractures, head injuries, arm fractures. So all of those things that come with falls, but then just the baseline things of balance, building that person's balance up, building up their safety awareness so that they don't fall again.
So it's preventative and it's also after the fact as well. So you build up their strength, but then they also treat them after, an incident.
Exactly. Yep. Yep. That's probably our bread and butter. And then walking. I mean, if you do this long enough, you'll find a lot of people in the industry and outside of the industry that feel like physical therapists walk people. That it's one of my things that it kind of hurts me when I hear it, but like, oh, the physical therapist is going to come walk you. But we are the experts when it comes to walking. So if someone's walking funny, they're limping, if they have some type of dysfunction in their gait, we are the experts for that. And a lot of times we might just be in there for walking and balance, which again prevents a person from falling and helps them function better and live better and all that stuff.
You usually use a lot of equipment in physical therapy. I see a lot of PT centers that use almost like gym equipment or bars or boxes or things like that. Do you use those kind of things in PT?
In outpatient therapy, yes, you're generally going to be outpatient is where you're going to see most of your equipment. You won't
Yeah.
see much equipment in the hospital. You won't see much equipment in home health, but outpatient. And then when you go to inpatient rehabs, which, you know, a lot of people look at as nursing homes, but a nursing home should be split into short-term rehab, which is people coming in, recovering from an injury and then going back home. You'll see more equipment in there. You'll see more equipment in outpatient when you're trying to get someone to an optimal level. But generally speaking, when you're just trying to get someone to a functional level, meaning a level that they can just live in their home and be safe, you don't need much equipment. So only equipment I carry is a gait belt, which is a belt I put around people's waist so I can hold on to them while they're walking or while we're doing balance activity. I very rarely use any equipment beyond that. But in outpatient, you know, there's quite a bit of equipment.
Yeah. You must have to train yourself to be strong enough to support your patients.
Well, the crazy thing is if any of you ever go to physical therapy school, you'll realize this, it's all about technique. So
Okay.
if you are dependent on your strength and dependent on your body, hopefully you go to a school that will really, you know, get that in your head early, so you don't go in that way. Because I have seen physical therapists go into it that way. You won't last long. It'll beat your body down, your back, your legs, your knees, whatever. They will be done in a matter of years, and you'll get that physical burnout. So there's physical therapists that I've worked with and went to school with that are 100 pounds soaking wet, and they can move a 300-pound man. But it's all about knowing your leverage. It comes back to, as much as I hate physics and chemistry, that physics really does kind of lend itself to making you understand how a 100-pound person can move a 300-pound man without straining, you know, just using their body as a fulcrum and using their leverage and stuff like that. So you'll indirectly use some of that thought process when you get out there and you're trying to lift people. I've moved 500 and 600-pound people, who, usually you would use a lift for somebody like that, but, you get in a situation where you can't use a lift. What do? You get low,
right?
And you use physics to get that mass moved, and you'd be surprised what we can do more with our mind than we can with our body. Your body has limits, your mind really doesn't. So it's kind of one of those things when it comes to lifting and technique and everything.
That's good to know. Yes, I have my son's girlfriend is going to Pittsburgh for PT school, or
Nice.
she actually is undergrad, but she's eventually will want to go to PT school,
Nice.
and she is like 100 pounds soaking wet. So I cannot imagine her lifting a 300-pound man. But you're right; it's all about technique, and it's all about learning properly, how to use physics to your advantage.
And if I remember correctly, that's a really good school. I think they have a really good.
They do. Yeah, she's going to Pittsburgh she just changed from biology to psychology as her undergrad major.
Nice.
So we're hearing the same thing.
Nice.
She's focusing on science, but she's also taking, a little bit of a different route. So she's starting her sophomore year undergrad and looking forward to PT school eventually. So this was great information. Do you guys, I know we have I'm Melissa said about a couple more minutes. Does anybody have any other questions for Dr. Petty? Anything that you'd like to? Octavian just joined us a little bit a while ago. So if there's anything that you would like to ask, use the chat feature, unmute yourself. I know we had our students expressed interest in the sciences. So this was great. We had a marine biologist last week, come in and speak. So we have, it's great to hear about these different professions.
Yep.
I think we had some.
Everybody.
Yeah.
Everybody finds what they want. Don't. One thing I would look at is just, the cliche of love what you do. I thought was just very corny when I was in high school, but love it. Make sure you love it.
Yeah.
Make sure it's something you really want to do. Do not think about you know, the money. Can I ask a personal kind of question?
Yeah,
Sure.
Lewis, go ahead. You want to unmute or you want to chat? It's up to you.
I was gonna ask. So, I got referred to a physical therapy session, but it's kind of far away from my house. So, I haven't gotten to go, and I got I had to go get my physical for soccer, and they didn't sign my physical until I got seen by a physical therapy
Mm-hmm.
doctor. But I had just had a question if like you had any tips to getting like knee pain out of the way or anything like that.
Knee pain. Yeah, that's gonna be a very broad question. I can't see you, but I'm assuming you're young and
Yeah.
you know, no real issues. So when you're that young and your knee is hurting, it's probably something you're doing to your knee. You know, it's probably some overwork or, you know, something you're doing the wrong way, you know, creating too much stress. My little girl plays soccer, so I'm very familiar with soccer. Sometimes it could just be your body's not conditioned to handle how much you're putting on it. One, I would say definitely go ahead and see the physical therapist. You don't necessarily have to go to whoever they referred you to. It's always the patient's choice to pick whichever physical therapist they want to deal with. And if you find somebody who's 5 minutes away and you're more comfortable with, go to that person, kind of let them evaluate your knee. But more than likely, it's a conditioning issue rather than like a, you know, like an impairment issue. Because generally it's not much that can happen with your knees when you're that young and you're active in a sport, aside from you might just be doing something a little wrong or doing something a little bit too much.
Right. Thank you. I appreciate it.
Good morning. It's Art Russell. I'm one of the monitors. I just wanted to chime in because I coach basketball at the high school level here in the city of Philadelphia. The Black Doctors Consortium is actually doing physicals this weekend for all students that are in high school that are looking to play high school sports. It's $30, and I think they're at 2100 Wesley High Avenue, and they're doing that this weekend.
Nice.
Yeah, I did see it. It was Monday, Wednesday, and Friday, I think.
Yeah, that's it. That's the dates.
Yeah. Yeah, I was thinking about going, but I have to make an appointment for Friday then.
Okay. Well, great. Thank you so much, Dr. Petty. We're getting kicked out in about 15 seconds. So I want to thank you so much. And students, thank you so much for listening. This is very informative. Appreciate it.
Anytime. You're welcome.